Hello, class of Child Development 120. My name is Rose Marie Stroud, and today I am going to be talking about depression in middle childhood, targeting ages 6 to 11. Just a fair warning, I will be talking about suicide, so just want to kind of throw that out there before we get started. Depression. Major depressive disorder or clinical depression is a mood disorder that has serious impacts on an individual's mood and can cause chronic sadness, irritability, or hopelessness. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, which is created by the American Psychiatric Association, it's important to know kind of like the criteria for depression, and so I just went ahead and included a few of them. Being depressed mood, fatigue, loss of energy for most of the day, almost every day of the week, loss of pleasure in normal activities or things that used to be enjoyable, feelings of worthlessness or excessive or inappropriate guilt nearly every day, diminished ability to think or concentrate, make decisions, and recurrent thoughts of death, suicidal ideation without a specific plan, a suicide attempt, or specific plan for committing suicide. These are all things that a person that is suffering from depression can experience. It does not have to be all of them. It can be just some of them. And I wanted to include that you need to be diagnosed with depression by a mental health professional, like a psychiatrist, for example, and usually a diagnosis is provided once a person is significantly affected or impaired, and this is usually going on for an extended period of time and can be impairing their ability to function in school or in social interactions. This was a picture that I found that I thought was a good way to kind of introduce childhood depression, and it was directed at parents, which I thought is very important because it is up to adults to protect children and make sure that children are being taken care of. And some of those things would be spending time with children, talking to them, keeping open communication, and also protecting them from mistreatment and stress and even physical violence. Making sure that children are getting enough sleep and eating right, being physically active, and having hobbies or things that they enjoy are very important. And when children start to display warning signs, that's when they need to be seeing a trained professional. So now we are going to talk about some of those warning signs or red flags that children might be displaying. So the very first one I have listed, frequent opposition or irritability. You might be noticing that your child is having mood swings more frequently and out of control, and maybe they are displaying opposition. Maybe they are defying rules from parents or teachers or other caretakers that they might have. Behavioral issues kind of stemming from opposition at school or home. Acting out can be a sign of wanting attention, and that's a big thing. When children can't really understand their feelings, they are likely to act out to get attention. Another really important one is monitoring a child's sleeping habits. That could be anything from insomnia, staying awake at night because they have a lot of stuff on their mind, stress, and that could also be oversleeping, kind of like that avoiding of school, avoiding responsibility, avoiding life. Same with eating habits. Sometimes stress can cause children to not want to eat, and sometimes they might overeat as a personal coping mechanism. The final one I have here, not being able to focus on their schoolwork or other activities, reading, things that they, used to enjoy, because they just aren't interested. Maybe they just have a lot of other things on their mind. So I wanted to also touch on children having natural mood swings as they grow and get older is very normal. But once they start having difficulty enjoying their everyday activities, that's kind of the biggest red flag. As adults, it's kind of up to us to pay attention to a child's common behavior and know the child. That way, when they start acting out of their normal behavior, it's, you can kind of just immediately start trying to talk to your child and open up the communication. And being able to have that trust with a child is very important, because we're talking about kids that are 6 to 11 years old, and these feelings of worthlessness, hopelessness, sadness all the time can be very, very confusing, especially when children have these outside things happening in their life that could be causing their depression, that might not really even revolve around them personally, but just things that are affecting them. So, I think that it's also important to talk about a little misconceptions about the depression for children, and for people that just think that it's easy or carefree part of life. It's not. Children, they're going through their peer acceptance and social norms, and this is always changing and puts a lot of stress on children trying to fit in and go with the ever-changing evolutions of society. And in our book, on page 387, we talked about how having no close friends at age 11 was a pretty big predictor in depression, just a couple years later at age 13. Bullying, obviously, is a really big one for depression, and that's kind of stemming into school issues. At school, there are endless stressors for children, trying to keep up with all of their studies and maintain friendships, and staying focused and on track can be overwhelming. I also included parent expectations, because I think that sometimes parents can put a little bit too much stress on their children and have these high expectations that just create more and more stress on top of the other things. A little bit more psychosocial things, lack of love, care, attention, and abuse or trauma in the home. These are all things that lots of kids go through, and just because the adults in their life are not taking care of them properly can cause children to kind of harness this self-identity that there's something wrong with them, and can really, really send them into a bad spiraling train of mental thoughts. Predisposition to mental illness, that is just kind of like our family and genetics, family history, and that's tied in with chemical imbalance. A lot of times depression is just a lack of serotonin in the brain, and brain development is important. Sometimes it's up to a mother all the time. It's going to be up to the mother to take care of her body while she is pregnant, and when a mother is doing things like drugs and alcohol, it can create issues with the brain. So here I just have some pictures. A girl looks like she might be getting yelled at, and she's very young. She's not going to be understanding why her parents are taking their anger out at them. Another girl looking like she's not really fitting in, and a child who is just having a hard time focusing. So the final thing I'm going to be talking about are treatment options. We have therapy, inpatient and outpatient. Inpatient therapy can be staying at a hospital. We actually have an inpatient psych ward at Methodist. I've been working there for a few years, and that can be a really great place for children to go when they are having a crisis. They can go and stay for 5 to 7 days and be around mental health professionals constantly. And outpatient, that would just be kind of like seeing a therapist. I also have cognitive behavioral therapy listed. That is focusing on helping children navigate their thoughts, teaching them how to think more positively and control the negative thoughts so that they do not get overwhelmed. And finally, medication. I have that because, like I said, chemical imbalances in your brain. Sometimes they might need an SSRI, selective serotonin reuptake inhibitors, which are antidepressants. Lastly, I added coping mechanisms because I think that for a lot of children, if they can just have some time to learn about ways to take care of their body and their mind and kind of have these healthy coping skills to keep themselves enjoying things that they like. And I think that's a really important thing that children have gotten away from. So this has been my presentation on depression. We really need to be taking care of these kids and making sure we understand the signs and symptoms, the red flags, how to observe those things, and getting those children the help that they need. Thank you.